I think I can call you Lucy now, after all these years. I must say, this is just an extraordinary super time. It's my absolute pleasure to be here. I was thinking, I first met, or at least encountered Lucy at the old PGH when I was a first-year neurosurgery resident in 1969, and then at the old Children's in Bainbridge Street 6 months later. But it was really when I joined Children's in 1975, after I finished my residency, that I really began to be influenced by Lucy, who, from my point of view, is sort of a genius of Gestalt. I mean, at a time when recognition of pathology was looking at slides, we didn't have fancy stains, we didn't have anything, but there was this, Lucy would look down and say, "Don't you know what that is, Derek?" And my answer usually was, "No, I don't." But I remember the very first real encounter with Lucy that I remember was I was a young staff member at Children's, and there was a difficult kind of tumor called a craniopharyngioma, which goes at the base of the brain. And in my residency, I had never seen anyone take it out completely. But there was this guy in Switzerland called Yassagel who was apparently able to do this. And so even before I met Lucy, maybe I had a little bit of an ego and desire to do well. After I met her, it was horrendous. But so I operate on this child, and I was so proud of myself. It was just in the CT area, and I thought I'd taken out the craniopharyngioma completely. So 2 or 3 days later, I get a call from Lucy. "Derek, I think you should come up to my office." So I went up to Lucy's office, which was a very small office, with a double-headed microscope and completely wall-to-wall and floor-to-ceiling with slide boxes and all over the place. And I sat down on the other side of the microscope, and Lucy said, "What are these?" And I was looking at cells, and I must say I was sort of proud of myself. I said, "I think they're neurons." And Lucy said, "Yes, Derek, they are. Why did you take out this child's hypothalamus?" Now, the hypothalamus is this little critical area of the brain that when you take it out, people die. So I felt a bit like a kid caught with my finger in the cookie jar, So my immediate response was, I didn't. And then I had to explain to Lucy the child was alive, doing well, seemed to be functioning well, and I was sorry I'd taken out a few neurons. Well, the point of that was that then we actually understood that these peculiar tumors didn't have a capsule, did invade with this sort of fibrous astrocytic response, but with neurons in it. And that part of taking them out was to try to take as few neurons as possible. So that was my first introduction. And this was the time that CT had just been introduced, and then a few years later, MRI. And we had this incredible group of people with Lucy, with Dr. Blanning, Dr. Zimmerman, neuroradiology, neurosurgery, because for the first time in history, with the CT scan, we could actually see the brain. That every other test we'd had up to that point demonstrated blood vessels, cavities, but we never ever could see the brain. And of course, we had no idea what we were looking at. And yet we were treating these children on the basis of these incredible new studies. So it was an interesting time. And the next response I remember from Lucy was that we would sit in these conferences and look at these scans that had these great big tumors, several centimeters in size. And at one point, Lucy said, "Well, Derek, if the tumor's 2 centimeters or 3 centimeters in size, how come I only get 4 cells to study?" And again, we were caught out. We had to explain. It was very difficult. They bled. We had to suck them up. But knowing Lucy, we worked a little harder to get her more tissue. But the point of that was that now with a lot of tissue, the whole concept of what we were dealing with changed. Because Lucy was seeing with tumors that she'd only had a tiny bit, now there was lots. And these tumors were not all the same. And they weren't all the same medulloblastoma. And then we could correlate with the scans what the tumors looked like, how the children did with the pathology. And all of a sudden, this was, you know, a really big deal. And that happened also for me with Lucy with pineal tumors. We'll talk about it a second later. The other thing I remember during these years was that the preemie children in the ICU often had cerebellar hemorrhage when they died. And no one could explain why they should have cerebellar hemorrhage. I remember being in an autopsy with Lucy and pointing out that, you know, these were venous hemorrhages. In other words, they were veins that were bleeding, not arteries. And we ended up thinking about this. So the reality was all these little infants were ventilated with a tube in the trachea, with a roll underneath their necks. And these were thin muscles, thin bone, and almost certainly we were compressing the veins from the cerebellum. And that was producing the cerebellar hemorrhages. So again, you know, long before we even thought about transitional medicine, we had in fact pathology, neuroradiology, neurosurgery, clinical medicine, actually combining to make some sense of all these new things we were seeing. So that was another really big deal for me. The last clinical story I'll tell you was probably, for me, maybe the most impressive ever. I was operating on a 6-year-old at Children's here, and this was a little boy who presented with intractable vomiting and had on scan a really small lesion sitting in what's called the obex of the fourth ventricle, which is the lower part of the brain, and is where the vomiting center is. And a very difficult place to operate, and we often had kids who couldn't breathe, couldn't swallow afterwards. And it turned out his sister supposedly had had 2 operations at Hahnemann for a cerebellar astrocytoma, a kind of tumor. So I went in and I operating on this, and I send the usual tiniest conceivable biopsy I was brave enough to take from this area of the brain. And we're standing around in the OR waiting for the response from, I know Lucy is religious, so I won't say God, but as I'm not, I thought it was God. And all of a sudden, the intercom goes off, and I'm expecting Lucy to tell me what this is. And her first response is, Derek, stop. Whatever you're doing, close up and get out of there. And I thought, oh, sorry, God. And I said, well, what is it, Lucy? And she said, this is focal Alexander's disease of the brainstem. Now, I was a little older by then, and I thought I was important. So I thought I might just take Lucy on this. And I said, Lucy, Alexander's disease affects the hemispheres of the brain. It gives you a big brain. It affects infants. They don't live long. They're retarded. So it can't be. So she said, Derek, do as you're told. So in fact, I did. I closed up, and about 45 minutes later, I came out of the operating room, and there's a stack of reprints this high, because these were the old days. We didn't have computers. We had reprints on the desk from Lucy for me. And these were all cases of brainstem Alexander's disease. Not one of them had been diagnosed in life. They were all children who had been misdiagnosed for other things. And I thought, holy God, this woman has just diagnosed the first case of focal Alexander's disease in the brainstem in a live person. And that for me was what Lucy was all about. I mean, there was just this invariable sort of aura of, you think you're really smart, Derek, but I'm a wee bit smarter. And the final short tale, in 2000, Lucy and I were together at a meeting in Martinique. And on the way back, the airport was on strike. And there were a bunch of very large people trying to stop us getting through customs to get on the airplane. And so we sneaked upstairs, and there were two lines. So our colleagues went through one line, and we were going through the other line. And this is this very, very large striker who's in our line who's saying, sorry, you can't get through. And it looked to me as though he was going to actually start physically pushing Lucy around. So wanting to be her knight in armor, I jumped in front. And I said something like, how dare you handle that old lady that way? Well, not too long later, I went home, and Lucy had been talking to my wife, Frances, and pointing out that, how old does your husband think I actually am? And of course, I was completely wrong. Lucy has never aged. I suspect never will age. And I think, Lucy, what I got from you that totally affected the rest of my life was that your approach was never self-aggrandizement. It was always perfection, teach enlightenment, do the best you could. And if you really did the best, probably there wasn't anybody who was any better. So there was a little bit of ego in that as well. But and for me, that was it. I always wanted to be perfect. I'm not sure I ever quite achieved that, but I must say, it's my absolute pleasure to be here and to say thanks to you, an extraordinary doctor, a great human being, and a wonderful mentor.